हेलो एवरीवन, हम लोग बात कर रहे हैं साइकोलॉजी के क्वेश्चन आंसर की। ठीक है, इसमें हम देखेंगे फोबिया क्या होता है। व्हाट आर फोबियाज? इफ समवन हैड एन इंटेंस फियर ऑफ स्नेक्स, could this simple phobia be a result of faulty learning? Analyze how this phobia could have developed. An intense, persistent, irrational fear of something that produces conscious avoidance of the feared subject, activity, or situation is called a phobia. Phobias can be in degree and how much they interfere with healthy adaptation to the environment. Some otherwise normal and well adjusted person also have phobias. Phobias are mainly three types: specific phobias, social phobias, agrophobias. Specific phobias are those directed towards a specific object and situations, can be varied. Example: acrophobia, fear of heights; pyrophobia, fear of fire; and hydrophobia, fear of water. Social phobia is a fear of social situation, and people with this phobia may avoid a wide range of situations in which they fear they will be exposed to scrutinized and possibly humiliated by the other people. Agrophobia. It is a term used when people develop the fear of entering unfamiliar situation. Social learning theories work on the principle that our experience, be it positive or negative, such as phobias of lizard, cockroach, are the result of learning processes which start early in life. Small children can play with snake. They are not aware of the danger involved. For them, it is just another play object. As they grow up, the fear of these things are instilled by their parents and society, which is reinforced and accounts for reaction like phobia. A psychoanalytical accounts for the same could involve attribution to some unconscious or and repressed experience. For example, suppose in your childhood you watched a group of rowdy boys brutally torturing a cockroach snake which eventually died. Although you going about the incidents after some days, but it might remain in back of your mind forever. This might explain your phobia to cockroaches, which might remind you the incidents and disturb you emotionally. Question number 11. Anxiety has been called the butterflies in stomach feeling. At what stage does anxiety become a disorder? Discuss its types. Anxiety is usually defined as a diffused, vague, very unpleasant feeling of fear and apprehension without any apparent reason. Therefore, it has been called butterflies in the stomach. An anxious individual shows combination of the following symptoms: rapid heart rate, shortness of breath, diarrhea, loss of appetite, fainting, dizziness, sweating, sleeplessness, frequent urinations, tremors. Types of anxiety disorder. There are many types of anxiety disorders. A. Generalized anxiety disorder, which consists of prolonged, vague, unexplained, and intense fear that are not attached to any particular object. The symptoms include worry and apprehensive feelings about the future, hypervigilance, which involves constantly scanning the environment for danger. It is marked by motor tension, as a result of which the person is unable to relax, restlessness, shaky and tense. Other symptoms of anxiety. Panic disorder consists of recurrent anxiety attacks in which the person experiences intense terror. A panic attack denotes an abrupt attack of intense anxiety, rising to a peak when thoughts of a particular stimuli are present. Such thoughts occur in an unpredictable manner. It continues for 6 and 7 minutes and 10 patient becomes normal. Sorry, it's done. Clinical features: shortness of breath, dizziness, trembling, palpitations, choking, nausea, chest pain or discomfort, fear of going crazy, losing control or feeling of dying. Phobic disorder. People who have phobias have irrational fear related to a specific object, people, or situations. Phobias can be grouped into three main types, that is specific phobias, social phobias, and agrophobias. Specific phobias are the most commonly occurring type of phobias. Specific phobias are unwanted fears caused by the presence of anticipation of a specific object or situation. This group includes irrational fears and such as intense fear of a certain type of animal or insect. Social phobias, intense and incapacity fear and embarrassment when dealing with others. Example, crowded market, fear of closed spaces, stage fear. Agrophobia. People develop a fear of entering in an unfamiliar situation. Many agrophobias are afraid of leaving their home, so their ability to carry out normal life activities is severely limited. Obsessive compulsive disorder. Obsessive behavior is the inability to stop thinking about a particular idea or topic. The person involved often finds these thoughts to be unpleasant and shameful but cannot control them. Compulsive behavior. Thus, it the need to perform certain behaviors over and over again. Many compulsions deal with counting, ordering, checking, touching, and washing. Obsessive compulsive disorder. People affected by this disorder are unable to control their preoccupation with specific ideas and are unable to prevent themselves from repeatedly carrying out a particular act of CDs of act that affect their ability to carry out normal activities. In OCD, unwanted thought combined with compulsive act. Post traumatic stress disorder. People who have been caught in a natural disaster such as tsunami, victims of bomb blast by terrorists, serious accident, in a war related situation. Symptoms: immediate reaction, that is denial and disorientation. Physiological reactions, example recurrent dreams, nightmares, and flashbacks. Cognitive reactions, example impaired concentrations, memory loss. Emotional numbing, example emotional numbness and suicidal tendencies. Social reaction, example apathy and withdrawal. Thank you.